Good morning. Is that too loud? Or not loud enough? Okay. Got you. All right. Well, good morning. Great to see everybody today. This is so exciting. I'm already inspired. I'm already learning new things. We're already chatting with our colleagues about how can we get involved in that, right? There's so much more to do and so many great opportunities. And I'm going to tell you about a few of the ones that we've been working on together with Harris as well as with others. But first, I'll start out with a little bit of background of how the McKinsey Health Institute thinks about these things. We are a nonprofit entity within McKinsey. We're dedicated to adding years to life and life to years, and we are non-revenue generating. None of our work is commissioned by clients, and we do all of this because we believe that we can substantially add to the global economy and to global well-being by focusing on health. And within that, brain health is a major component. So imagine a world where we could invest holistically in our health. That's our physical health, our mental health, our social health, and our spiritual health. And that will allow us not only to live longer, but to live better. And I'm going to talk about how investing in brain capital can unlock millions of years of healthier life, healthier, more productive life. And that is how we, I think, are going to make this brain positive economic transition. So this is the illustration of the opportunity we have, because as we see that as we age, our quality of life decreases sharply. I guess all of us who are aging know that. But interestingly, I mean, we spend almost, in the United States, we spend almost as much time in poor quality of life as we do in positive quality of life. And so what we call squaring the curve is not only increasing global life expectancy, but increasing the portion of life that we spend in good health, right? This is all economic gain. And so that is foundationally how we conceptualize health at MHI, but I think this is also a good model to think about where is the opportunity for the brain economy. We've done an analysis using the IHME data. We call it a tool called Prioritizing Brain Health that we have on our website. And you can do this for every country that's in IHME. And what we've looked at is not only the burden of disease, which is sort of well documented in the Lancet and in WHO, looking at what is the direct burden of mental and substance use disorders, in which we estimate to be about 170 million disability-adjusted life years. But what we wanted to do was look at what we know to be true, is that people with mental and substance use disorders also have very high rates of chronic disease, infectious disease, right, and concomitant physical health conditions, either related to, directly or indirectly related to their mental and substance use disorder. And so when you take all of that into consideration, we see that there's about 333 million disability-adjusted life years associated with this population. And not only that, what we have to declare as a mandate is that we must scale what works, because I think a lot of people see this number, and even my own colleagues some years ago saw the number and then they said mental and substance use disorders are a leading cause of disability worldwide, and they have almost the lowest probability of being able to address that burden. And I said, but what are you talking about? There are so many interventions that work. We have so much science. And they said, yeah, but there's stigma. People don't want to get care. You don't have enough workforce. People don't stick with care, et cetera, and you can't pay for it. And I was like, well, why would we bake that kind of stigma and discrimination into our estimates? Right? That's not the ambition that we should set for ourselves. The ambition should be, as we did with COVID, like this is how we were going to get rid of it. We didn't really know how we were going to pay for it, but we came up with vaccines and we have tackled it in the way that we have. And so that's the same idea that we had behind our prioritizing brain health. We looked at hundreds of interventions and we realized that about half of the disability burden caused by these conditions could be averted if we just scaled what works. Like, we don't even have to innovate, and we should, of course, still innovate. But even if we just did what we know we can do now and made that available to everybody who needed it, we would have half of this burden. And that should be our ambition. And that gets me to what are the essential levers to sort of unlocking a brain-positive economy. I think first and foremost, setting a bold ambition. And by that, not just something incremental, but really something, a sea change, right? Something measurable, something achievable, but really representing a transformational change in how we address these issues. Cross-sectoral collaboration, Harris already called it out. We have researchers, we have bankers, we have innovators, we have policymakers, we have consultants in the room. Everyone has to come together to do this. Early intervention. We know that half of these conditions show up by the age of 14, 3/4 of them by the age of 24. I'm talking about mental and substance use disorders, not all of the whole neurological spectrum, of course. So these are diseases of the young, and the peak burden is between the 20s and 30s. And so unlike chronic diseases, which happens as peak burden in 50s and 60s, we have the opportunity to start early, to promote positive health, and to prevent the longer-term sequelae that affect not only individuals, but also communities and economies. So that's an imperative. Start early. And then scaling what works. As I said, we know how to treat many things. You know, we look at something like first episode psychosis. We see such tremendous impact of coordinated specialty care and the model of care, the evidence-based model of care that can really change the entire trajectory to keep schizophrenia from becoming a brittle condition, and that people can really live with their schizophrenia as a chronic condition or have it go into remission. But in the United States, only between 10 and maybe 25% of people have access to that care. And that's unacceptable. And innovative financing. You know, we've looked around the world, we've looked at many, like coordinated specialty care, great evidence-based interventions, and there is a challenge of scaling them because people, governments, companies, insurance companies don't pay for what works. And so we really need to look at, it has been an underinvested area, partly because of poor economics, poor finances, but also because of lack of information and a lack of set of clear targets. And so this is something that we think we need to work on. So speaking of a bold vision, we have shaped this together with our colleagues at the Kennedy Forum and the Alignment for Progress. And we take our inspiration from UNAIDS, the 90-90-90 fast track targets. So we have this is a brag and steal. We're bragging about what we did, but we stole it from UNAIDS. But 90-90-90. 90% of individuals are screened for mental and substance use disorders. 90% of those screened will receive evidence-based treatment, and of those receiving treatment, 90% can manage their symptoms in recovery. And all of this, the Alignment for Progress group in the United States has proposed that we achieve 90-90-90 by 2033 in the United States. And we think this is achievable, not only because, why not, but also because if you think about HIV, in 2014 when they came out with the fast track goals, they said 90-90-90 by 2020, 95-95-95 by 2030, and that's the way we're going to contain the AIDS epidemic. They were at that time 60, 46, 38, right? 60, 46, 38. And by the time they got to 2022, we were at almost 90 for all of these and above 90 on the last one. Right? So this is absolutely achievable. They did it in 8 years for HIV. I think we can challenge ourselves to do this in 9 years for mental health and substance use. This is cross-sectoral collaboration, right? This is public, private, social sector needs to be involved. And this is, you know, civil society, healthcare, human services, public sector, private sector. Everybody in this little wedge, not readable to all of you, but you can see it on the Kennedy Forum website if you want to go look for it. But this is an interactive tool that you can use to do your planning if you are doing efforts to advance brain capital. You know, these are all the different groups that need to be engaged. And we need to make it clear to each of these sectors what is their role, not only what is their role, but what is their gain, right, from contributing to the brain economy. And this is the early intervention. This is the peak disorder, as you see. It happens earlier in life for our younger people for mental and substance use disorders, giving us this opportunity here, right? Like this is our sweet spot for what we can be doing to preserve brain capital, promote, right, like positive brain health further down in life. Scaling what works. This is how much can be reclaimed, right? We can reclaim almost half of the burden that we're currently experiencing. And these are, when we were looking at interventions, we're looking at behavioral interventions, social supports, including peer support, things like exercise, psychoeducation, school-based interventions, psychotherapies, of course, as well as therapeutics. And we are really excited at McKinsey Health Institute to be working with a coalition of partners, many of you who are in the room today, thinking about how do we address the mental health funding gap. Right? United for Global Mental Health has estimated there's a $200 billion a year gap between the level of global need and the amount of investment that governments and private companies are putting into mental health today. How do we close that gap? We need to bring together funders, we need to bring together institutions, innovators, as well as investors and philanthropies to think about how can we connect on this, how can we inspire people who aren't currently engaged to get engaged. I know many of you are more recently inspired because the folks in the room are amazing. How do we de-risk some mental health investment by championing some innovative approaches? And then how do we integrate, right? We need to ride the wave of maternal health, of climate, of women's health, right? Like there are opportunities for us to become integrated with the brain health efforts in other movements that are already making progress. And finally, so we were very excited, I think this was mentioned, we published this article last week with Andy from WEF and Harris and me, with our colleagues from all the organizations contributing, Erica Ko, Darshini Mahadevia, Gio Lee are here from MHI. You can click on the QR code, you can see what we're doing. We are gonna be announcing our Coalition for Mental Health Investment next week at the Clinton Global Initiative. One of the things that we're doing is we are stating that everybody has a role to play. We invite you to get engaged. We invite you to make a commitment. How are you going to contribute to the brain economy? And how can we partner with you to make the progress that we need? We see the innovators and the leaders here that we know can make this happen. Thanks.
Thank you so much, Kana. I was definitely just the meager warm-up act for you, Kana. So brilliant presentation and to set us off very strong. Next, I'll hand the microphone over to Shiva Dustdar. Shiva is the boss, the dean, the director, the head of the European Investment Bank Institute. The European Investment Bank is a wonderful financial institution that we're very grateful for helping us think through systemic finance and investing. And Shiva has been a very welcome part of our family, our team in the last couple of years. So thank you so much, Shiva, for being here, for flying in from Luxembourg, and we look forward to your remarks.
Thank you very much, everyone. And it's really great to be here in person. Last year I was on the screen. I don't know whether it was here or somewhere else, but just not the same, as much as we would love to move things virtually. So let me maybe start with actually a question that, two questions. One is, how much is your brain worth to you? And the other one is, how much would you be prepared to invest in your brain? So I would like you to sort of keep these two questions in your mind as I'm going through some of the thoughts about how the EIB has come into or is in the space of innovative financing, and also kind of bring a bit my own personal perspective and journey into it. I mean, when I mention to colleagues in the wider investment community in EIB that I believe the brain economy is the next big investment opportunity, it's quite interesting the sort of reactions I get. Some think, Shiva, you know, quite esoteric as always, forward-looking. Good for her, you know. She obviously sees things that we, you know. Others, they are actually sort of thinking, well, obviously it's such a big problem. A lot of money must be going there. You know, so... And then when you start giving them the figures that we've now heard a few times, 2 trillion global burden of the disease per year, which somebody mentioned to me would be twice the US defense budget per year. We heard the sort of 2/3 of the Indian GDP. I mean, these are, you know, we're talking big numbers. And I think when you then mention that actually, given all that spending on the disease and on the lost income, and we have what, 200 billion of market gap. You know, you would think any rational economist person actually would say there is a case for prevention, there is a case for active investment, and we are just not doing it. So it is really interesting that we are where we are in this discussion. And maybe just to add another personal anecdote, I mean, this summer we were visiting with my husband our daughter, who is actually sitting also here in her lab. She's sort of doing her PhD in neuroscience. So, you know, that's hopefully also giving, I hope that with that I learn also a lot of what is going on in the field. But we were visiting her lab at Harvard Medical School, and we were quite impressed by all the cutting edge equipment, by, you know, all these quite impressive ways of having virtual reality and implants. I mean, we're two simple bankers. I mean, we just, you know, thought, wow, a lot's happening with these little mice, implants, you know, virtual reality, AI, all that coming together. But then we were also shocked when we heard that they are trying to answer rather basic questions about memory and learning that apparently we don't have any answers for. So we're like thinking there's something, you know, clearly there is, you know, we do need to accelerate getting to the answers. And also the head of the lab was telling us that recently, if I understood correctly, the NIH has prioritized cancer over brain funding, so there's also that happening. So anyway, a lot, I think, you know, that I think gives us food for thought. Now, I'm coming at it from the perspective of, indeed, an economist. I just studied a few miles up at Columbia University 30 years ago, and then started my career on Wall Street at JP Morgan, 60 Wall Street in the early 90s. So very much coming in at it from financing in those last 30 years in new frontiers, new markets, the last 20 years really in innovation. How do we make sure that we have money go where it is most needed? And this is really coming, or this has certainly been the focus the last 20 years at the European Investment Bank. So that for those of you who have never heard of us, it is indeed twice the size of the World Bank. So, you know, so you are really missing out if you haven't heard of the EIB. So you may want to Google us. We are the Bank of the European Union. So we are owned by 27 member states of the European Union. And we're also very often called the EU Climate Bank, being the largest investor in climate. Now, we come into the healthcare space as a public sector investor. And in that role, we analyze every project based on economic and financial returns. And especially in the healthcare sector, we always have, as you can imagine, high economic returns, low financial returns, because clearly we don't want hospitals and the healthcare sector to maximize returns. Now, this is why, because of that, you have to have public investments coming in, and from institutions like the EIB, but also other public investors who come in precisely because the economic benefits outweigh the financial returns. Now, another example to, again, make that case is in the area that I've been very actively involved in, which is in innovative tech solutions, you know, investing in those companies. What we call is, from a financial perspective, an asymmetric risk-return distribution. So basically, you have the entrepreneur who is taking all that risk, scientific, technological, financial, putting, you know, his whole livelihood and that of the family and the fools and everybody else into this company. The returns are not just for, you know, him or her, but they are really societal. If there is an Alzheimer treatment coming out, if there is a clean tech solution coming out, the society benefits, far outweighing, therefore, the risks. And this is precisely the case why banks like ours need to come in to de-risk, to come in and be that patient capital that comes in earlier, that may stay longer, in order to actually do some of that rebalancing of risk return. So let me maybe leave you with two key areas where we have come in as the EIB. One is on the health and one is on the climate front. On the health front, 12 years ago, we had a group of European TB, tuberculosis vaccine developers, knock at our doors. They had heard that the EIB was increasing its risk appetite in its lending, and they thought, hey, let's give it a shot. I have to say, some of us had never really thought of TB in any major way at that time, and certainly not thought of financing a vaccine. We looked at it, and with the best of intentions, we just did not see how we could have a bankable case, an investment case for those developers. But it did trigger our curiosity, and we then started looking at the wider infectious diseases, and it was interesting. I mean, I see parallels, although they're very different, certainly areas, but I see parallels in the sense that we really saw that mainly only grants are coming into that space. These are poor country diseases, the market perspective, the financial return was not there. Long story short, we visited actually the NIH. We met with Anthony Fauci in 2013, who gave us a US case, and Gates Foundation, all of those, and this is together with the European Commission. We realized, well, if grants have been so far only, been used, how about we get some of these grants to be blended into a financial instrument that help de-risk the EIB to actually a large extent. I mean, this was a very high sort of risk transfer from the EIB to the Commission in a blended instrument. So the grants, if they would just be spent, they're out the door, you never see them, right? If they come into a financial instrument and give us that risk buffer, in case of a success, when we then actually make that loan to the TB vaccine developer, and there is a successful outcome, they repay, and there's also return, and that money can reflow again into the system. In case of failure, we are where we were with the grant, so to speak, right? Money just out the door. And this concept then became, we then launched an instrument which was called the Infectious Diseases Finance Facility under the Innofin program, which was, used to make some very targeted investment in that space of, infectious diseases. Now, what was interesting is, of course, come March 2020, so 5 years later, we were ready to go to put a rather large, to put some large tickets, such as 100 million into BioNTech, just when BioNTech was starting the negotiations with Pfizer. If we had not had such an instrument and the capabilities to assess such, such investments, we would not, and the risk transfer, we wouldn't have been able to do so. Maybe the next quick, instrument that I just want to highlight to you are green bonds. I don't know whether anybody has heard of green bonds here. Yes, so green bonds. For those of you who don't know them, in 2007, the EIB actually was the first issuer of what was called the climate awareness bonds. This was a very clever way of going to the capital markets, issuing AAA bonds, raising money that would then ultimately be invested in climate mitigation instruments. This is a market that is now 600-700 billion in size, and the EIB to this day remains the largest issuer of, we call them either climate awareness bonds or sustainability awareness bonds. These are SDG linked, where the use of proceeds then go towards these causes. Now, the reason I mention that is, and I think I may have mentioned this place and other places, how about, could you imagine a brain awareness bond? Because clearly the challenge, as we have heard, is as high as climate and maybe even higher. And therefore, so we have the climate, the CAP, the SAP. I don't know whether that would be the BAP. I don't know whether that sounds right. We would need to agree on the color. I asked my daughter, is the brain pink or gray? I don't know. We need to agree whether it's pink bonds or gray bonds. But these would be ways to get institutional capital into the space. And therefore, I think I would like to leave you with the thought of, innovative financing, yes, who are the players? Who could we find? Governments issue green bonds right now. Companies issue green bonds. Imagine, let's see who we can find to issue actually brain awareness bonds or brain bonds for that matter. And then the question is, would you invest in a green bond, of course, but also in a brain bond? Thank you very much.
Shiva, you could have just dropped the mic and walk away. Like, just everyone can see why we're so grateful to Shiva and how Shiva's elevated our consciousness and the opportunities that we have in store if we engage in banking and finance in a thoughtful way. So again, thank you, Shiva. Now, in the interest of time, let's turn to Devora Kestel, who's the director of the WHO Department of Mental Health, Brain Health, and Substance Use. Devora is actually dialing in from, I think, Geneva, and she is here already. Devora, over to you. Thank you very much.
Thank you. Thank you very much. Good morning, and sorry for not being there with you this year. It was hard to answer to all the things happening. Do you hear me well? I hear an echo.
I think we can hear you well, yes, and there's no echo on our end, but we'll
Okay, great.
see if we can get rid of the echo for you.
Go ahead. I was saying that, yeah.
Oh, Devora, the audio has gone. You've been muted.
Somebody muted me.
Okay, all right. You're back. Devora, start
Yes,
again, and we won't mute you this time.
Okay, thank you for being so kind. You invite me and you also let me talk, so that's great. So I was saying that in order to be respectful of the time I was giving, I'm not going to comment on the many interesting things that were saying before me. So hopefully we will have opportunity, some of you, at another time to have this conversation. But I think it is great that we all come together and share a common goal to protect and invest in the body's most complex organ, that is the brain. Our brain allows us to sense, feel, think, move, and interact with the world around us. It is integral to our physical and mental health, our well-being, and the society we live in, as we will get out, and we heard already in the previous interventions. Over the past decades, neuroscience and brain health research have made great strides in improving our understanding on how the brain, body, and mind work together. But public health and policy responses for brain health are still lagging behind. With more than 1 in 3 people having a neurological disorder at some point in their life, neurological disorders were the leading cause of disability-adjusted life years and years lost of life lost globally in 2021. Neurological conditions can strike at any point in life. Many are chronic, requiring management, support, and long-term care. Many factors can affect the way our brain functions, posing significant threats to brain health in the form of diseases or missed neurodevelopmental potential, but they also represent great opportunities for action. In 2022, WHO released its brain health position paper to provide a common framework for promoting brain functioning at all age. And I would humbly suggest that you look at it, because it is very important that we agree on what are we talking about and try to avoid as much as possible use different definitions and frameworks. So the position paper outlines that optimizing brain health across the life course means addressing determinants such as physical health, environment, safety and security, lifelong learning and social connection, as well as access to quality services, which in turn will improve brain structure and functioning for longer lasting individual and societal benefits. The diverse determinants clearly show that brain health is not the responsibility of the health sector alone. Brain health affects all aspects of society and requires comprehensive multi-sectoral responses, as outlined also in the Intersectoral Global Action Plan on Epilepsy and Other Neurological Disorders, IGAP we call it, that was adopted by 194 WHO member states, countries, in 2022. The IGAP lists 10 ambitious targets to be achieved by 2030 by 2031, and propose bold actions for countries. So we have already some targets agreed by 194 countries. Maybe we want to look at them and see how much the individual networks, at individual countries, are interested in supporting their members, their countries in those targets that have already been identified. And those targets are for countries, but also for international and national partners, and of course, for WHO Secretariat to support countries to promote brain health and strengthen services and human rights for people living with neurological disorders. In that, IGAP represents a unique opportunity for political prioritization of brain health at national and global level, strengthening systems for integrated services for neurological disorders, from early identification and diagnosis to management, rehabilitation, and long-term care, for increased collaboration across disciplines, and mobilizing robust investments in actions that optimize brain health across the life course to bring about real societal change, improve health outcomes, and lift development and well-being globally. In short, making brain health for all a reality requires efforts of everyone. Only with such a comprehensive response can we ensure that people affected by neurological disorders and their carers attain the highest possible level of health with equal rights, opportunities, respect, and autonomy. I look forward to working with all of you on the implementation of the Intersectoral Global Action Plan on Epilepsy and other neurological disorders, and I thank you for your attention. Just to note that I'm coming for the rest of the UNGA event next week, and we'll be happy to meet with some of you. Otherwise, we can always follow up online as we are so used to do. Thank you very much, and back to you.
Last but not least, Annika, please join us on stage. We have a very special guest from Stockholm, philanthropist and investor Annika Sten Pärson, who's founding partner and executive chair of the Inner Foundation. And Annika is very important in the context of this first set of keynotes because, as you can tell, we're all about 4P partnerships, public, private, philanthropic partnerships. How do we mix and weave public, private, and philanthropic dollars to try to improve outcomes for people with mental and neurological conditions? And so Annika has kindly agreed to join us to represent philanthropy and also direct investing. So thank you very much for joining us. And do you have slides, or are you just... Yes, I have it. Okay, brilliant. All right.
The first one is... Thank you, Harris. Yes, I guess I represent a slightly, I think, very important but different perspective to this conversation. So the stats are clear. We are in the midst of a global mental health crisis. And this crisis is not just affecting individuals, but seeping into the very foundation of our society. So in this room of change makers, each one of you bring a different perspective to the conversation. Ours and my organization is mental health, mental well-being is in the front and in the center of our mission at the Inner Foundation. The concept of brain health or brain economy was actually, until very recently, unknown to me. Thanks to Harris and the Brain Capital Alliance, I'm now enlightened. However, the link between cognitive and emotional well-being, as well as brain health and skills, was known. Mental health is linked to brain health. When mental well-being suffers, so does brain functions and development. I'm here to share a little bit about the work we do at the Inner Foundation, with the focusing on mental health, specifically for emerging adults, and why it demands our, what I would say, urgent attention. So a little bit of a sort of personal story, why I'm here, about my journey. My name is Annika Sten Pärson. I'm born and raised in Sweden. I have a long corporate life behind me in a C-suite level management position across media, telecom, and fast-moving consumer goods. So what the heck am I doing here, right? But after approximately 25 years in these roles, I felt the growing need to align my work with my personal values. And having the opportunity to actually move to this exciting city in 2013, I took a role after I did some other works prior to that, but took a role as the CEO of Selene Institute, which is a non-profit thing focused on vulnerable women in the 5 boroughs of New York, addressing perinatal mood and anxiety disorders. And I saw firsthand the mental health crisis and how it both is very sort of on an individual level, but it kind of hits me as somebody sort of hit my face, that it's also a systemic issue. So even if we have, and at the same time, one of my dear family members were going through a really hard time. And it kind of hit me that even if you have all the means, you have network, it's really, really hard to understand sort of the path to recovery. And that became sort of the starting point for the work I'm doing today. So when we returned to Stockholm in 2018, I couldn't really see myself going back to the corporate world. And I went back to school, pursued a training as a therapist. And additionally, I founded a small NGO in Stockholm called 1825 Therapy Center for Emerging Adults. And one thing led to the other. And my interest for this like live stage, like 18 to 30-ish, far beyond my own experience, I remember how that was, and my children's struggles. Me and my husband, a few years later, founded the Inner Foundation. Using our experience in life, using our then financial resources and human resources to address the growing mental health issues, with a specific focus on emerging adults. So the Inner Foundation was born out of the recognition that we no longer can afford to stay on the sideline of this growing mental health crisis. The cost of doing nothing became too high for us. The Inner Foundation is a non-profit foundation investing in mental health and DIB solutions. Our mission is very clear. By investing in engaging changemaker, we are building and scaling solutions that work. Our aim is to be part of building an inner foundation that makes part of building an inner foundation that makes for an outer world worth living in. That's hard to say, actually. I have to work on that. And strengthen mental well-being and foster diversity, equity, and inclusion and belonging. At the Inner Foundation, we believe the intention is a powerful force. Every investment that we make is guided by a clear purpose to create a lasting, meaningful impact on the inner health of emerging adults, directly or indirectly. And that focus allows us to place our resources where we believe they will have the greatest potential to actually transform lives. To maximize that impact, and that came very from the get-go for us, we have a hybrid financing model, providing flexible, tailored finance support for organizations ranging from non-profits tackling grassroots issue to for-profits developing scalable technology solutions. So for us, that flexibility of funding is really important. We also fund ecosystem initiative in addition to that. By blending grants, loans, and equity investments, we aim to catalyze long-term change and empower impact-driven organizations to grow sustainable, regardless of the financial structure. Our model, as been said here before, it's built on patient and catalytic capital. Things takes time, and time is of essence. Allowing changemaker the runway of pivoting, adapt, learn, and to strengthen their value proposition is really important, and that's not a sign of failure. Mental and brain health are not isolated from the broader societal fabric. They are shaped by the complexity of socioeconomic status, race, gender, war, intergenerational trauma, and identity. These realities drive how we approach our investments and allocate our capital. This is exactly how it looks like in a young person's brain, maybe in some of our brains as well. Our decision to focusing on emerging adults is very both intentional and necessary. This is a group that have been falling in between and are unrecognized and overseen. There are 8 billion emerging adults on this planet, and are 2 times more likely, in comparison to other age group, to suffer from depression and anxiety. What makes this demographic particularly crucial is the ongoing brain development that occurs during these years. When mental health challenges like anxiety, depression, and disconnection occur during these states, they don't just impact emotional well-being, they can have long-lasting effects on cognitive development and reduce productivity. These disorders are widespread, and as we learned, I actually had 1 trillion not long ago, and now I'm changing that to 2.3 trillion is the cost of doing nothing. And this group, again, are additionally navigating one of the most formative periods of your life, marked by major transitions and challenges. Completing education, entering the workforce, forming meaningful relationship, stepping into adulthood, all come with immense pressure. However, these years are also a time of high vulnerability. Emerging adults today are facing unprecedented challenges: socioeconomic instability, social media influence, and self-worth. And uncertainty about the future is an area of rapid social and environmental change. By investing in their mental health during this crisis-critical phase, we can actually mitigate this economic cost and create a profound and lasting impact on both their brain and overall well-being. There is no doubt that we as a small foundation, even though we, from our point of view, putting a lot of financial efforts into it, we can't do this alone. That's kind of obvious. It's part of something, and partnership and true collective efforts is by all means absolutely necessary. At the Inner Foundation, we understand that the crises we face are systematic. The issue we tackle, whatever mental health challenges or disruptions to brain health caused by stress, trauma, and social disconnection, are part of a broader ecosystem. We have, in our work, at the very core, a framework to foster collaboration and partnership. We are committed to think and act both on a systemic and a very hands-on level, as investing in and seeding into this ecosystem of change by supporting solutions addressing the mental health needs. For us, being catalytic means both. Go upstream and go downstream. The two perspectives feed into one another. This is why this concept of brain economy really sparked our interest. The brain economy movement recognized that cognitive, emotional, and mental well-being are central to human capital. It calls for systemic thinking that integrates the health of individuals into the broader societal and economic fabric. We salute this approach and believe its potential to unify, align, strengthen amazing work that is already happening. And, of course, in addition to that, bring more resources, solutions, and capital to the cause. I think it's vital, as Shiva, you were talking about, and I heard you on a webinar a few weeks ago, and you really inspired me, to the conversations and the concept to be understandable, accessible, and actionable. We are all doing different things. The importance here is to connect the dots, not to be caught up in the complexity to the extent that maybe some of us actually become paralyzed. And some of us actually, this creates this perception that this systemic is just fluff, and it's not investable. Leadership through the power of true examples of interdisciplinary job, intersectorial work, I think are essential here. The field of brain health has to be recognized, has to be driven by hope and potential, and has to be seen as investable. Thank you.
Annika, thank you so much for this call to action. At the end, we need public investors, private investors, and also philanthropic investors in this space. And you showed beautifully how you make the systems approach a reality at the Inner Foundation, and we have a lot to learn from it. So thank you for that. Thank you to all the keynote speakers. We'll now